press conference today, the Oregon Office of Emergency Management says the governor's aggressive stay-at-home order is putting the state at an advantage for fighting this coronavirus. And KEZI 9 News reporter Con McCarthy is here live in the studio with what this means for cases here in Oregon. Connor.
State officials say researchers from Washington State discovered Governor Kate's Brown early action to essentially shut down the state and keep people at home is working to flatten the curve. If we stay on our current trajectory, they say Oregon will see a steady increase in cases that will not overwhelm our hospitals. State officials say they have been working closely with the Institute of Disease Modeling outside of Seattle. Researchers say Oregon will not see a dramatic spike of cases like we are seeing in major hotspots around the country. State officials say this data doesn't predict the future, but reflects what Oregonians are doing now. But officials say Oregonians must stay home and there must be enough personal protective equipment in order to achieve these results.
And if we can accomplish those things, we are cautiously optimistic that here in Oregon, the cases seem to be rising at a level that we'll be able to care for the people who need it most.
Dr. Slinger says that the positive results we are getting now are a snapshot of time 2 to 3 weeks ago when patients first contracted the virus. It'll take more time to see the full effect of the stay-at-home order. And state officials say this news should not be a signal for people to ignore the stay-at-home order. Oregon still has not seen the peak of the pandemic yet, and state officials say in order for our hospitals to avoid what is happening in hotspots across the country, Oregonians need to stay home to save lives. Reporting live in the studio, Connor McCarthy, KEZI 9 News.
Connor, thank you. And there is a shortage of N95 masks at fire stations as well. And